morning, Dr. Bada. My name is Shane McCoy, and today's February 7, 2015, and I'll be doing my second validation, which is giving a patient a bath while the patient is in bed. So first thing I want to do, I want to verify the physician's order. Then I would do hand hygiene. Then I would gather my equipment and supplies necessary for the procedure. In this instance, what I would need a pair of gloves. I need a washcloth. I would need a bath basin. I need soap. I would need a blanket. I need a towel and the patient's gown. Then after that, I'm going to walk inside the patient room. Then I would verify the patient by the ID band. Then I would introduce myself to the patient, explain the procedure to the patient. Then I would provide privacy for the patient. Next, I want to bring my table close as possible to me. Put my gloves on. Then I would fill my bath base with warm water. Then I would have the patient check the water as well, just make sure that the temperature is appropriate for the patient. So what I want to do, I want to cover the patient with this blanket because I'm going to take off this top sheet here. I could raise the height of the bed, appropriate working height, so I'm not straining out or hurting my back. At the same time, I'm assessing the patient. So what I could do, I could lower the side rail. Roll it inside out. Make sure my side rail is up. And I could put it, if there's a chair there, I could put it on the chair. But for now, I'm just going to leave it on the outside over there. So what I would do, I would make a mitten. And this is just water, no soap in this. And it'll wash the patient's eye from the inner canthus to the outer canthus. And different eye get different part of the washcloth. I will just pat dry. Continue washing the patient, washing their cheek. Long, firm strokes. Wash behind the ears. At the same time, while I'm doing the ears and making sure I'm checking inside of the ears, make sure, just checking to see if there's any blockage like cerumen or any foreign body that got stuck inside the patient's ears. Once that's done, then I would pat dry. So now I can remove the patient's gown. While I'm removing patient gown, I'm at the same time maintaining privacy for the patient. Very important for the patient. In this case now, I'll be applying soap to my washcloths. I will continue to make them in. Apply some soap. Starting from the wrist. So basically I'll be doing from distal to proximal. Nice long firm strokes. Wash under the axilla. Wash it out. Rinse. In water from distal to proximal. Nice long firm strokes under the axilla. Just properly wash, clean. Then I would look at the fingers. If the fingers need to be soaked, then I could probably put the finger inside the base and let it soak for say 3, 4, 5 minutes. But in this case, fingers are looking good, so I could just wash them. Wash, and I would rinse from distal to proximal. Then I would pat dry. And at the same time, I'm assessing the patient's skin, make sure there's no lesion, no swelling, no redness. Same thing, you want to make sure you dry under the axilla pretty good. Once I'm done with the right arm, then I will do the same thing on the left side. Continue to make a mitten. Apply soap. Washing from distal to proximal. Nice long firm strokes. Under the axilla. Assessing the arm. Rinse. Make a mitten. From distal to proximal as well. And I'll pat dry. I could do the fingers. Soap. Washing from distal to proximal. And I would rinse. Then I would pat dry. And next I'm going to do on the chest.
Okay, Evan. So I'm going to take the towel and I'm going to place it on the head area where we're going to wash your head and face.
I will continue to make a mitten. Apply soap. And I will wash. Then I would rinse. Then I will pat dry. So each part of the patient, I wash, I would assess that area as well. I will wash, continue to wash.
Don't move. Right there. Okay? Don't move. Hey guys, my son just got into an accident. He's literally up the block. Okay? I'm going to go there and I'll be right back. Somebody take my cell phone number, please, because I'm technically not supposed to leave you here, but there's nobody else. Okay?
Then I would rinse.
Just trauma, so anybody.
In this instance, I want to make sure I get under the fold of the patient's breast.
4891.
Make sure it's nice and clean.
Don't leave.
Make sure there's no lesion or any swelling. Then I would pat dry. So next I want to do a start on the leg. One thing you want to make sure, when you're lifting the patient leg, you want to support each joint. And if you need to do any form of range of motion, this is the appropriate time you could do range of motion, whether it's either passive or active. So I would continue to make a mitten, apply a little soap on my rug, and I would start from distal to proximal with long, firm strokes. And also, if it's an elderly patient, you just want to be careful with the skin, because elderly patient, their skin is pretty much frail and thin, so you don't want to cause no trauma to the patient's skin. You're assessing for any like bruising or lesions. And your rings from distal to proximal. If the toes need to be soaked, you can soak them in warm water. At this time, patient's toes looking good, so let's continue to wash with soap and water. From distal to proximal. Now the rings. Then I would pat dry. If you need to apply cream, this is the perfect time to apply cream. To maintain privacy for the patient. Then I'll move to the next side. Make a mitten. And simply, you want to continue to check the temperature of the water, make sure it's not getting too cold. If that's the case, you may want to change the water. But the water is still at a good temperature, so I could continue, put a little soap. Washing from distal to proximal. Continue to assess the patient's skin for any lesion, any bruising, any swelling, if any pain from the patient, they will pretty much tell you. And our rings. Continue wash from distal to proximal. Then I would pat dry. And another thing you want to keep in mind, if this patient is an obese patient, you want to make sure you're getting inside the folds of the skin and so forth. Make a mitten. I'm going to do the foot next. I'm going to get between the toes. And one rings. can apply lotion as well. But keep in mind not to leave any lotion between the patient's toes, because those could cause skin breakdown.
I would be patting dry with a towel underneath the head, this washcloth, whatever it is.
And at this time, what I would do, I would change the bath water. So this is clean water. But before I leave the room, what I would do, I would raise the sideway, lower the bed, take off my glove, maybe do some hand hygiene, get some clean warm water, come back inside the patient's room. After I wash my hand, then I put on fresh gloves. So what I would do, I would have the patient roll over to the opposite side of the bed. So what I could do, ask the patient, if the patient can assist, ask the patient to hold on to the opposite side rail. Have the patient cross his or her legs. And have the patient turn over. To use soap and water. I'm going to wash the back. So I would wash from the neck down towards the buttocks, because the buttocks is the dirtiest part as opposed to the top part. So wash like in a circular motion. Assessing the patient back. Checking the lesion, any skin breakdown, any sign of pressure ulcer. Discomfort for the patient. Then I would rinse. And I could pat dry. I'm going to do the buttocks. Soap and water. As you can see right here, there's some redness right on the buttocks. There's just a kind of stage 1 pressure ulcer. So I'll chart that later on. And I'm going to wash the buttocks, so it go from front to back. Then I would rinse from front to back. Then I would pat dry. And I could roll the patient back over into his or her back. So what I would do on a raised side rail, lower the bed into the lowest position, take off my glove, do hand hygiene. Then I would discard the water, get me some fresh water, come back inside the room. So now I'm going to do perineal care. Soap and water. Do from front to back. Make sure I get inside the folds. Wash. As a female, I want to get like in the, the major labia. Maintain privacy for the patient as well. Rings. Then I would pat dry. In this case, I could put the patient down. So what I could do now, get me a fresh blanket. So I got a fresh blanket here and I got a top sheet. So what I could do, I could put on the sheet first. Now I can remove this blanket.
Professor Lang, I'm coming for a little bit.
Got me a fresh blanket here for the patient. Make sure there's no crease on the bed, prevent pressure ulcer. So what I want to do, I want to change,
We're going to start with the chest.
could change. To my pillowcase. Raise the side rail. Put the bed in the lowest possible position. Call bell in the patient's reach. Take all my dirty linens, put them inside the dirty hamper, and I would take my basin with me, wash it out, and I'll take off my gloves. And I'll do hand hygiene, then I will document. And that's the end of my validation of it.